2014 Technical Assistance Orientation webinar. The JMHCP program is a very important initiative to help reduce the prevalence of individuals with mental illness that are in our criminal justice system and to promote further collaborations between organizations in both the criminal justice and mental health systems. After brief presentations by our speakers today, Maria Fryer and Nikisha Love-Weaver from the Bureau of Justice Assistance, or BJA, and Phoebe Potter and myself, Cynthia Kimmelman DeVries, from the Council of State Governments Justice Center, there will be time for a question and answer session. To ask a question, please type the question into the Q&A panel on the bottom right-hand corner of your screen. We will do our best to answer your questions. If your question does not get answered during the webinar, please follow up via email after the event has started. At the end of the presentation, we will provide email addresses for everyone speaking today. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. Again, 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we are recording this event and we will be emailing the recording to all of the attendees as well as posting it on our website later this week. Starting off the webinar today will be a welcome by Bureau of Justice Assistance staff, information about the current round of grantees, as well as discussion on the budget process. Following this will be a short presentation by the Council of State Government staff on technical assistance and what we do, and then we will conclude with time for Q&A of both BJA and CSG Justice Center staff. I'll now turn things over to Maria from the Bureau of Justice Assistance.
Great. Hi and good afternoon. Many of you may be expecting to hear a different voice today, that of Danica Brinkley. I am working with Danica and new to the policy office at BJA. My name is Maria Fryer, and although I'm new to the policy office and as a new policy advisor, I come from many of the community programs that you represent, as well as administration, and while in that role was charged with finding solutions for local and state jurisdictions, as well as justice-involved clients that were encountered there. Now at BJA, I look forward to working with you in this endeavor. So with that, we've got to first open this orientation by recognizing and acknowledging your accomplishment. You have succeeded in securing grant funding in an incredibly competitive year. You represent the top 27% of applicants in 2013. Your applications were screened for basic minimum requirements, were reviewed, rated, and scored by panels of external peer reviewers. And after an internal review by BJA staff, you were recommended to the Assistant Attorney General for funding. So congratulations to you on your award. In addition, the applicant pool was so strong that we did not compete the JMHCP this year because there were so many competitive and accomplished applicants to select from in 2013. Therefore, we did not release the JMHCP solicitation in fiscal year 2014, but instead made selections from the unfunded applicants. As recipients of this award, you each share a common goal to effectively work with people with mental illness in your local jurisdictions and to create positive system-wide change for justice-involved people with mental illness alongside many other professionals across the nation. In total, we received 244 applications in fiscal year 2013, and we're only able to make 34 awards this year, representing 27 states, 6 of which are in the planning category, 17 in planning and implementation, and 11 in the expansion category. This includes 13 mental health court diversion programs, 7 programs that focus solely on juvenile populations, 15 co-occurring reentry grantees, and 6 law enforcement-focused grantees. So what are our expectations of you? Since each program was reviewed and selected based on criteria that uniquely qualified them as most competitive, I want to lay out some very specific expectations that we have of you. We expect that you will serve the number of people you proposed within your application, that you will actively take measures to seek appropriate services for that targeted population or services designated to meet the needs of the population you serve, that you will use evidence-based risk and needs assessment instruments to accomplish this, that you will incorporate evidence-based trauma-informed treatment practices and interventions into your services and into your justice system response as a whole, that you will seek help when help is needed and communicate regularly with your technical assistance coaches and BJA staff to include your program manager or myself, your policy advisor. So your expectations of us. Well, you can expect that we will support and assist you as you set out to reach the goals of your program. We want you and your staff to have the necessary tools to serve critically underserved populations for the betterment of the communities where you live. Both the program staff and policy staff will be responsive to your inquiries as they arise, whether they are technical about allowable use of the funds, changes in key staff, requesting no-cost extensions, or whether they are regarding key changes in the state, county, or local level that you foresee potentially impacting your program. We will provide quality technical assistance through the Council of State Governments Justice Center. And a couple of words about the CSG Justice Center. They really brought to light the need to better serve people with mental illness in the justice system through their landmark consensus project in 2005. The Justice Center is the technical assistance provider for JMHCP grantees. Each of you will have a technical assistance coach assigned to you by the Justice Center, and we expect them to call you, email you, and challenge you and support you. Overall, considering everything shared so far, what we are trying to achieve here is better outcomes for people with mental illness in our systems. Specifically, we are looking for reduced recidivism rates, fewer jail bed days, and improved functional outcomes such as the attainment of stable housing, opportunity for employment, long-term employment, and fewer hospitalizations. We've revised our performance measures so that we are asking you for data in ways that can best capture this information. In order to continue this work, we must have the information to communicate to stakeholders about what this program is accomplishing, how it is affecting change, and how grant funds are used to accomplish this change and report results. We also look at performance data to make program improvements along the way. So a little about us. Next, I want to tell you a bit about the Bureau of Justice Assistance and the Office of Justice Programs. I work in the Policy Office as a Policy Advisor for Substance Abuse and Mental Health at the Bureau of Justice Assistance. I oversee a number of programs pertaining to the intersection of substance abuse and mental health within the criminal justice system, including the JMHCP program in addition to the Second Chance Act programs. More recently, BJA's efforts to assist our criminal justice partners in the implementation of the Affordable Care Act, which, as you know, will allow greater access to substance abuse and mental health services, especially for those reentering their communities from prisons and jails under expanded Medicaid eligibility. We are a small staff dedicated to translating best promising practices into quality policies and programs for the criminal justice field. Also within BJA is the Programs Office. The Programs Office manages the individual awards that each of you have received, and as such, you have been assigned a grants manager, either Nikisha Love or Veronica Munson. Nikisha and Veronica will be your contacts within BJA who can answer all of your questions pertaining to allowable costs, management of the award, and reporting. We work closely together to ensure that all JMHCP grantees remain on track with their awards. So with that, I'm going to turn it over to Nikisha, who will talk about the budget approval process, accepting your award, yay, financial clearances, and other grants management issues. Thank you.
Thank you, and good afternoon. I'm Nikisha Love. I'm the grants manager for the Justice and Mental Health Program. Along with myself is Ms. Veronica Munson. At this time, I wanted to say congratulations to all of the 2014 recipients for the Justice and Mental Health Awards. When it comes to budget approvals, 95% of the grantees you all should have received approved awards. Those of you who have not received approved budgets, either myself or Ms. Veronica Munson has been in contact with you in regards to getting your budget approved. Special conditions, we ask that you please read the grant awards to see if you have any other conditions related other than budget withholdings. If you do, you would need to contact myself or Ms. Veronica Munson so that we can get that special condition removed so that you can have access to draw down your funds. In drawing down funds, you need to make sure you have already selected a financial point of contact so that they will have access to draw down funds. In prevention of drawing down funds, that means that you have a special condition withholding that is active, which is not allowing you to draw down your funds, or you have a budget that has not been approved. If you have that issue, please contact myself or Ms. Veronica Munson so that we can assist you with getting that done. As far as updates for the year, we will be in contact with you, not just myself, but the policy office along with CSG if new things come up. Contact information is very important within GMS because we understand that these awards are from 2013, so some of the same people may not be still in play. So that we ask that you go into GMS and update all of your contact information as far as your phone numbers, email addresses, and we ask that you at least have 3 different persons selected within each of those contacts, which you have the point of contact, the financial point of contact, and of course the authorized rep. If there is the same person within those categories, we ask that you have a backup person. So if you're unavailable, there is someone that we can contact to get some type of assistance because the way that we contact you is through GMS. So everything needs to be updated with the emails because when we send you things, it comes through GMS. And if the email is not updated, then you won't get the communication. So again, on behalf of BJA, myself and Ms. Veronica Munson, we say congratulations. We look forward to working with you, and we hope that this will be a successful year. I would like to turn it over to Phoebe.
Thank you, Nikisha, and hello, everyone. My name is Phoebe Potter, and I am the Director of the Behavioral Health Program here at the Council of State Governments Justice Center. Like BJA, we're very excited to be working with you this coming year, although our role will look somewhat different as your technical assistance providers. I'm going to provide you with information about our organization before turning it over to my colleague, Cynthia, to provide more detailed information about our technical assistance resources. The Council of State Governments Justice, or CSG, is a national nonprofit membership association representing state policymakers from all 3 branches of government. The Justice Center, which falls under CSG, provides practical, data-driven policy guidance on criminal justice issues specifically. There are 3 major national projects that we support within the Justice Center, and this will give you a sense of the scope of work that we do here. That includes our reentry program, which is the source of technical assistance for Second Chance Act grantees, which you may be familiar with. We also have a justice reinvestment program, which helps state policymakers specifically adopt criminal justice reforms that increase public safety and help reduce corrections costs. The third middle project that you see there on your slide, our behavioral health program, focuses specifically on substance use, mental health, and healthcare access issues for individuals that have come into contact with the criminal justice system. It is through that program, our behavioral health program, that we are able to provide technical assistance for JMHCP grant recipients. As you can see, all of the work at our Justice Center is really informed by working directly with practitioners in the field, and we look forward to utilizing that experience to assist you all with the implementation of your grant. You can learn more about our work at our website at csgjusticecenter.org. With that, I'm going to now turn things back over to Cynthia, a member of our policy staff here at the Council of State Governments Justice Center, to provide you with additional information about the technical assistance resources that we can make available to you as JMHCP grantees. Thank you.
Thanks so much, Phoebe. Hi, everyone. My name is Cynthia Kimmelman-DeVries, and I'm here representing a team of technical assistance coordinators who work under Phoebe Potter and David DeMora in the Justice Center's Behavioral Health Project. We're here to provide assistance to you over the course of your grant under the JMHCP program. Technical assistance means different things to different people. So the main goal of today is for you to leave this webinar with a sense of the types of things the Justice Center staff can help you with and the resources we have to draw upon. Over the course of the next year, our primary function is to help you achieve the goals you listed in your grant applications and that BJA funded you to do. On your screen now are a few examples of what your technical assistance coordinator can do for you or reasons to contact us. We can help you support your team's efforts through on- and off-site technical assistance. Off-site technical assistance are regular phone calls, check-ins, and emails we will have with you and your key stakeholders or partners, usually, for example, on a monthly basis. For on-site technical assistance, we have resources to conduct a limited number of in-person visits to those grantees that have a situation that would benefit from an in-person consultation by Justice Center staff and a content expert. Another thing we do is connect you with resources, such as research findings and practical tools, and experts, such as researchers and practitioners, who can help you resolve challenges you face in meeting your goals. Through the multiple technical assistance programs we manage, we're also able to connect you to individuals and programs that are in your shoes right now or implementing programs similar to yours. Through meetings online at our website, small learning communities, and webinars, and through our National Criminal Justice Initiatives map that's posted on our website and on your screen now, we're able to link you to programs that are implementing practices similar to your own. Shortly, you'll be able to sort on the criminal justice map by type of program, grant category, location, etc. In addition to our technical assistance, we have a monthly newsletter, which is a compendium of information on important topics on criminal justice and mental health collaborations in the field. It includes upcoming funding opportunities, webinar announcements, profiles of current and past JMHCP programs and their milestones, important research, as well as links to a number of articles on criminal justice and mental health that appear in national newspapers and magazines around the country. You can sign up for the newsletter from any page on the Justice Center website. And you don't have to wait for the monthly newsletter to come out to stay abreast of current information. If you navigate to the In the News link on the center of our page, you will receive real-time updates of the content that is compiled daily and weekly and that contributes to our monthly newsletter. Your technical assistance coordinator and the Justice Center will hopefully keep you from reinventing the wheel and make sure that if someone out there is doing something similar, you know about it and can benefit from their experience. If there's research that is relevant to your program, we'll connect you to it. And if there's an expert that can help you troubleshoot a problem that you are facing and help you achieve your goals, we want you to have access to them. We're also here to make sure that you're not alone in the process of achieving your grant goals. Your programs are spread around the country, and sometimes even your team members are located in different geographic areas. We're here to make sure you know that there are others who are doing similar things as you and make sure you are in touch with them. With these things in mind, I'm now going to talk a little bit about what your technical assistance includes. First, everyone will be invited to a JMHCP grantee orientation and conference this coming March in Washington, D.C. It's tentatively scheduled for the beginning of March, but the exact dates are not known just yet, and we're hoping to get that information out to everyone in the next month or two. The process is still being negotiated and approved, and as soon as we have everything secured, we will send out the exact dates and location to everyone. This is an excellent and very important event. Experts from the field will be presenting. There will be work sessions conducted by Justice Center staff as well as national speakers. You will have the opportunity to meet your technical assistance coordinator in person and network with your peers from around the country. Second, your TA coordinator will be helping you work on a planning and implementation guide, or our P&I guide, which you will be receiving in the next coming weeks. This is a structured process to help you think through some frequently asked questions and frequently encountered situations and challenges in implementing justice and mental health collaboration programs. In the next few weeks, we'll be hosting another webinar to orient you to the process, and your TA coordinator will be setting up a future phone call with you and your team members to specifically review the guide. It's not necessary to start completing the guide until you receive more specific direction from your TA coordinator. The P&I guide is a requirement for Category 2 planning and implementation grantees, but we do ask that all grantees complete it. For those grantees that have already been a recipient of a JMHCP grant in the past, which this year there's a number of you, you will notice this year that the P&I guide will look very, very different from years past. We'll be working closely with you to complete it over the course of your program. Thirdly, in addition to all the resources I've just mentioned, the Justice Center website has a vast library of written research documents, practitioner guides, as well as distance learning opportunities. All of these documents are free and downloadable from our website. We have a suite of publications on mental health courts, law enforcement, and probation initiatives. We have a checklist for implementing evidence-based practices, a report on prioritizing scarce resources for adults being supervised in community correction settings, guidelines for the successful transition of people with behavioral health disorders as they leave jail or prison, as well as our very popular Breaking Schools Rules publication on the school-to-prison pipeline. This was an unprecedented statewide study of nearly 1 million Texas public secondary school students and followed for at least 6 years. We also conduct a series of webinars over the course of the year, one approximately every month, on topics that have been requested by JMHCP grantees. There's also an archive of previously conducted webinars on a variety of topics that can be found on our website under the Resources heading and can be viewed anytime. Recent webinars include screening and assessment, data collection, measuring program performance, developing clinical intervention, trauma services, and gender issues in the criminal justice and mental health systems. In addition to those that are done monthly by the Mental Health Program, the National Reentry Resource Center also conducts a monthly webinar series on similar topics, all of which can be viewed through the page on your screen. You will also have a customized technical assistance plan. You have already been assigned a technical assistance coordinator from the Justice Center who will be familiar with you and your team and the grant goals you have outlined in your narrative. You will work with this coordinator over the course of the year to identify relevant resources, troubleshoot questions that are coming up as you're working with your grant, and make connections with other programs around the country. You and your TA coordinator will work on a TA plan, when it makes sense for you to be checking in and how they can be helpful. You will also work with your coordinator to identify whether or not your program is appropriate for one of our site visits. In addition to the planning and implementation guide, we will be sending you a TA worksheet. It's a short 2-page description of what technical assistance includes and also has a section where you can request specific types of technical assistance. So if you already know that there's something you would like more information about or contact with an expert about, it's an excellent way to address that and give your TA coordinator a heads up about it. You'll be receiving that by email when your TA coordinator contacts you. Lastly, the slide shown is an example of what the main mental health website looks like with the address at the top of your screen. I urge you to take a look at it, sign up for our newsletter, and explore the vast number of resources it contains for you to get information. If all things work as planned, when you close out of WebEx today, you'll be directed to a page on our website that will allow you to sign up for our newsletter. We encourage you and your teams to do this to start receiving this very valuable information. For those of you who've already subscribed to our newsletter, last year we updated the service we used to send out our emails. So if you were a previous subscriber to our newsletter and you haven't received an email recently, you may have to subscribe again. I hope that this has been helpful in giving you examples of what TA looks like from the Justice Center and some specific examples of the types of things that we do. At the end of the presentation, we will display all of our contact information. Please feel free to email the appropriate person for additional information, either the BJA staff for more fiscal and grant-related management issues, or either myself or Phoebe Potter as it pertains to technical assistance issues. As a reminder, we'll be emailing out these slides later this week, as well as posting the link to the recording on our webinar page in archive form. Okay. So we're not going to start the Q&A portion of the presentation. To ask a question, please type the question into the Q&A panel, which is located on the bottom right-hand side of your screen. I'm going to moderate the questions coming in from the participants, and we'll do our best to answer as many of your questions as possible in the time remaining. Again, if we run out of time, please do email one of us using the information provided on the screen. I do understand that from a budget perspective from Nikisha and her team that many of the awards have already been accepted and budgets have been cleared. So I'm not sure this year we're going to have a number of budgetary related questions, but if there are any content related questions or anything else that we can help you with, we ask that you go ahead and type those into your screen now. We have 1 or 2 questions that have come in. As we start to go through them and ask them of the appropriate staff, it'll give you some time to type in any other additional questions that you have. Okay, so the first question that came in is, when will the performance measurement tool be issued for this grant? If available now, where can we find those data points? Maria, I'm not sure if you're familiar with this just yet, so I will help jump in and answer this if this is helpful for you. It's about, I believe, the PMT system.
Yes, that would be great. Thank you.
Okay, terrific. So there is a separate system that BJA has contracted to develop called the Performance Measurement Tool. It has its own website. It's got its own help desk and a whole separate phone number for you to call about the PMT information. Nikisha, I think I might need some help answering this part of the question. I think the first reporting period starts and a first report needs to be done in December or in January?
It's due the end of December, so the reporting is usually quarterly, so it'll go from October the 1st to December the 31st, so the report should be due around January.
Right, I was going to say, I think it's January 30th that all of the information needs to be entered into PMT. And I believe that the agency that handles PMT, which is not actually CSG and not BJA, will be sending out contact information for everything I just mentioned, the website, the help desk, and how you log on to all of that information shortly. I believe that should be happening soon if it hasn't already. We can look that up and send that out to everybody when we send out a link to the webinar. We can send out that information as well.
Yeah, please include that for me, Cynthia, so that, because a lot of them probably don't have that information and they would need to go in to request a user ID and password.
Yep. I'm not sure on our end, I don't ever see the emails that come out, or CSG doesn't see the emails that come out, but they do come out from an agency called CSR. So if you're confused and you get emails from CSR, that is related to the PMT tool. Okay, the next question, this is very easy. The Grantee Conference is, yes, in Washington, D.C. It is going to be a approximately 2.5 days conference. Right now, it's scheduled to start on a Wednesday afternoon and go to Friday afternoon. So it's actually really full 2 days of programming, 3 actual calendar days. Depending on where you're traveling from in the country, if you're traveling from the West Coast, you'll probably need to arrive on Tuesday evening. If you are more local, you may be able to do your travel arrangements for Wednesday morning. But we will be sending out more information about that in the coming month or so once all of that information has been approved and all of the logistics have been nailed down. For those of you who are familiar with the Second Chance Act grants, and may have also received one in addition to your JMHCP grant both this year or last year, one of the things that we're doing this year is putting the Second Chance Act conference and the JMHCP conference back to back. So the first day of JMHCP, that Wednesday, is going to be an overlap with the Second Chance Act conference. So if you have both grants this year, we will be stealing about a week of your time because the SCA conference will be starting on Monday, going until Wednesday, and then the JMHCP portion of the event will start on Wednesday and go till Friday. Okay. Nikisha, I think this is a question for you. We have submitted our signed contract, but we have not received information that it was received. Should we expect confirmation? And I'm wondering if that might be a GMS issue.
Yeah, that could be a GMS issue. Whichever grantee submitted that question, please email me directly and include the grant number. That way I can look it up for you to let you know when the documents were accepted.
Excellent. And I would strongly encourage you from previous experience, anytime that you are contacting anyone from BJA, so that would be either Maria, Nikisha, or Veronica, depending on who your policy staff is, you always, always, always include your award number, which is the way that they're able to sort through who you are. So for example, just to call this out this year, there are 2 Rutherford counties that were funded this year in this cohort in different states. And if you just refer to your county, we might not know which award you actually are. There's also in larger cities like in California, in New York, there's a number of grantees that are awarded within the same metropolitan area by the same agency. So it's very helpful for us to know your award number. Otherwise, we have to spend time back and forth trying to figure out who you are. Okay. Is there a website for reporting sub-recipient information? I think, Nikisha, that's a you question as well.
Yes, you will be able to report that information within the PMT.
Okay, excellent. And like we said a little while ago when we send out the information, with a link to the webinar and the slides. We'll send out information about PMT as well. Can extensions be requested? Absolutely. Actually, I would say that probably in previous years, a full 3/4 of the grantees actually do end up asking for requesting an extension. And that will be something that you and your TA coordinator can work through as you get a little bit more into your grant and figure out where you are in terms of the different deliverables and outcomes that you've specified, whether or not you're achieving them, if you feel like you're a little bit behind, if there's any difficulties. But yes, extensions are usually granted. They're usually granted approximately for 6 months to a year. But we'll work with your TA coordinator to help figure out whether or not that's necessary, for how long, and the best way to submit those. Those are things that are submitted through the grants management system through GMS for the future. It looks like we don't have very many more questions, actually. So I'm just going to pause for a second, and if there is any other questions that anybody has, wait another couple minutes to see if there's anything that you'd like to type in. In the meantime, you should have received a couple of emails both from David Demora, which was announcing this webinar, and from Phoebe Potter with some different links that were not mentioned on the webinar. There's an FAQ that is on grant management issues that was in the email from Phoebe, as well as just a general FAQ with resources on a variety of different areas that you can find on our website, both links to our publications and then publications around the different kinds of programs that are being funded outside of the Justice Center that you might find of interest. Who will be required to attend the Washington, D.C. conference? Okay, so for planning grants, you must have at least, I believe the way it was written this year, planning grants need to have at least 2 people attend. P&I and expansion grants need to have at least 4 people to attend. We can send out the specifics from the solicitation to you. Who does that mean that you should have attend? Generally speaking, as your teams are getting together and you are navigating the different programs and your day-to-day operations, we usually encourage you to have somebody representing your criminal justice partner, somebody representing your mental health partner, and then the couple of other people that you might want to have attend could be other day-to-day program people that are working on your projects. So it could be a case manager, it could be a court administrator, it could be, if you're a law enforcement program, somebody that's handling incoming phone calls. We do a variety of different programming in all of those different fields. So attorneys, judges, evaluators, specific program staff in general have all attended in the past, and we have specific programming for all of those types of folks. But if you're confused, once you get on the phone with your TA coordinator and they understand a little bit about your program, they will work with you on figuring out who are the appropriate individuals to attend. It might be a little early for you guys to figure that out if you don't know who the specific people are that are working on your projects day to day. Okay, next question. For planning grants, will there be offerings for further phases? I haven't noticed implementation or expansion grants offered in the last couple of grant cycles. So this is always sad news for grantees, unfortunately the way this works is if you've received a planning grant in 1 year, it does not mean that you are or have priority for receiving a grant in a second year or the subsequent year, for example. So just because you have a planning grant and you want to develop a mental health court does not mean that you get priority consideration for that mental health court when you submit a P&I application in the subsequent year. It all starts from scratch, unfortunately. There is a P&I category that's appropriate for planning grants, and there's an expansion category that's appropriate for P&I grants, but you basically end up having to start from scratch. As Maria had shown you on those very first slides, this is a very, very highly competitive program. The first round of grantees that were accepted from the cohort in which you applied, so in the year you applied, 2013, out of 244 applicants, only 32 were accepted with a 13% acceptance rate. Previous years have hovered around 20%, so it really depends on the number of applications. So you just have to throw your hat back into the ring again and hope for the best. And work with your TA coordinator on developing a really good application for the following year. Okay. I have one more question, so as I read this question, if anything else is of interest to anybody, please do go ahead and type your question into us so that we can get that handled. Nikisha, I think that this is a question for you similar to the subrecipient question from before. The new federal super circular requires us to report detailed subrecipient information when awarding $20,000 or more to another entity. Do you know where we would report that information to be in compliance?
Yes, that's in the FAFATA. And I can send you the link, Cynthia, so when you send out all of the information, you can add that link to it also. And the grantee can email me directly.
Sure. Okay, we have one more question that comes in, and this is a question that we always get every year. How many implementation grants will be offered next year? Maria, I'm going to jump in and answer this one too. Let me know if there's anything else. Yeah, you'd like to add to this. Okay. So it really, unfortunately, one more time to disappoint you guys, it depends on the quality of the applications and the projects that you're doing and what's coming in next year. What we can tell you is that the JMHCP solicitation is being rewritten right now. So everything that you have been responding to in previous years, or for the last 5 years basically, is going to be changing a little bit. So the things that you see under target population priority considerations, including potentially the grant categories, may change next year. So the solicitation usually comes out sometime between February and late spring, May-ish, but BJA is in the process of rewriting that right now. So long answer is we can't tell you how many implementation grants are going to be funded. We can't tell you what the categories are going to look like exactly. And it depends on the quality of applications that there are, as well as the funding for JMHCP, which is still not entirely set in stone by Congress right now. So BJA doesn't know exactly how many applications they're going to be able to fund until they know how much money they can work with. So unfortunately, yep. Can't tell you that by a specific number. You can go on to the JMHCP page on the BJA website, which is in the slide presentation, and it will show you all of the grant awards from previous years. So you can take a look at roughly how many P&I grants were awarded in every year. I believe this year we had 17 of them, and last year I think we had 15. So if you're awarding about 35 grants every year, 32 grants every year, you'll see the same kind of numbers each year to answer that question. Okay. This is a question, Nikisha, for you. If our grant is active, can we assume our budget is also approved as submitted?
No. Just because the award is active, which means that you received the award, yes, but that doesn't mean that your budget has been approved. And the only way to know that is, again, is to look at the special conditions. If you did not have a conditional clearance withholding related to the budget, and if you did receive in your award package the approved budget, then yes, your budget has been approved.
Okay. And obviously, if somebody's unclear or unsure, they can do a couple of things. I think you can go into GMS and take a look. Also, if there's special conditions listed. Right.
Special condition withholding. That wouldn't prevent you from having the budget not approved. It would prevent you from being able to go in and draw down funds.
Okay. And I'm going to guess that if anybody's confused and unsure what they're looking at in terms of going into GMS or any correspondence they've received, they can always reach out to either you or to Veronica.
Yes.
Okay, great. As far as there was a question about how to access this webinar later, we are going to be sending out a link by email to this webinar and to the slide presentations and to the recording that we're making right now on our website. So we'll send out a link to our website where you can access it. Okay, this is a little bit of a longer question. I'll try my best to try and answer this. Nikisha, if I miss anything, please jump in and let me know, and Maria as well. Okay. Can you generally review what reporting requirements there are and when for each type? So all of the reporting requirements are essentially through the Performance Measures Tool, or PMT. I'm not going to review that in depth. I'll just very loosely tell you what that's going to look like, and then you will receive correspondence about that through your points of contact that are listed in GMS. So any information Nikisha had mentioned earlier, is very important that your authorized rep, your point of contact, and all of those names are correct, because anything about these reporting requirements are going to go to those specific individuals that are listed in GMS for information. PMT has a quarterly requirement for all 3 grant tracks. So if you are planning, P&I, or expansion, every quarter you will need to submit or respond to the questions that will be in the PMT tool for your track. It's pre-scripted questions. They ask you all things about, if you're planning, about your team and your stakeholders, if you're P&I, about the number of people served with mental health, co-occurring disorders, substance abuse, so on and so forth. And if you're expansion, they look very similar to the P&I questions. They are due 30 days after the end of the quarter. So if it's due, if you're talking January through March, the report covers the period January 1st through March 30th, and then it's due to BJA by April 30th. That's generally what happens for every grantee each quarter. And then semi-annually, so twice a year, you have a longer report that you need to do in PMT that has a lot more narrative information, asks you more open-ended questions about how your project is doing in general, asks you about what your successes are, if there have been any challenges, if there's anything in particular that you would like to share with BJA, and any technical assistance issues that you hadn't already reported to your TA coordinator or may have come up on any phone call that you had with them. That's generally the reporting requirements for the grant. As far as anything else collateral to that aren't necessarily reporting requirements, one of the special conditions that you need to fulfill, and that we had mentioned, or I had mentioned a few minutes ago, was the Planning and Implementation Guide, which is a much longer document that you're going to fill out with your TA coordinator that is actually a requirement for a P&I grantee. So in order for your grant to be successfully closed out by BJA, that needs to be turned in by the end of the grant. We ask that it get turned in between the stages of planning and implementation. So when you're done with the planning portion of your P&I grant, your P&I guide should be done in conjunction with your TA coordinator and then turned into BJA. For planning and expansion grantees, because the guide is new this year and we're finishing up the last pieces of it right now, we'll be working with you on which sections of the guide are important for you to turn in as well. I know that it's not a requirement for planning and expansion grantees, but we are going to be asking you to fill out certain pieces of it, which will help us develop our TA plan with you. Sheila, you don't have any additional questions?
Yeah, I wanted to piggy in,
sure, go ahead.
Chime in. Also, as far as the reporting, although you do go into the PMT to do the progress reporting piece that you have to upload into GMS. So the report does need to be uploaded into GMS. You go into PMT on a quarterly, but those reports are uploaded in GMS semi-annually.
Okay, great to know. And I'm going to guess that CSR will be sending out more information about that as well. I do have one more question, another Nikisha question. When will we receive information on how to draw down funds for reimbursement?
Okay. With the award package, all of that information should have been submitted on how do you go in to draw down funds. So you will have to read the full extent of the award because all of that information was in the award package.
Okay. And I would assume, again, if anybody has questions, didn't receive the award package, is unsure of what you're talking about, still confused, that they can contact either you or Veronica as well for more specific directions.
Yes.
Okay. Okay, on your screen you see everybody's contact information, and I always like to say there's a lot of people that are listed and whose names we have mentioned. I've talked the most. If you're unsure of who to contact about what, please feel free to send me an email prior to receiving any contact or information specifically from your TA coordinator. If there are no more questions at this time, then we're going to conclude this webinar. So this concludes the Justice and Mental Health Collaboration Program 2014 Technical Assistance Orientation webinar. Thank you all for your attendance and participation, and thank you to our presenters. We very much look forward to working with all of you. As you exit this webinar, a short survey will automatically appear to ask you about your experience on the webinar. We're required to report on participant responses to this sort of programming and very much appreciate your taking a couple of seconds to complete the questions that will appear. We will email a recording of this presentation after the event, and the recording will also be available in a few days on our website, csgjusticecenter.org/mental health. Thanks very much, everybody.